Good morning, everyone. I hope you've been enjoying the conference and all the amazing sessions thus far. As we near the finish line, I truly hope this has been inspiring and informative for you as it has been for me. My name is Myra Sky, and I am the Cause Marketing Manager and on-air community correspondent for 11 Alive News, NBC Atlanta, a Tegna station. And as one of the founding members of the DAA, I'm truly honored to be here. So thank you for joining this breakout session where we'll be having a conversation on the ongoing COVID-19 response and what marathon activation looks like for corporate and nonprofits. A key theme for this discussion is collaboration and power of partnership. I'd like to start with each of you on this panel introducing yourself. Go ahead and include a brief description of your organization and open the conversation with how your organization drives resilience through collaborations. So Jim, let's start with you.
Sure, thank you, Myra. Glad to be here. It's been a great couple of days. I am the Vice President of Disaster Recovery and Philanthropy at Good 360. Good 360, for those of you who don't know, is a 501c3 nonprofit. We make it easy for companies to donate products. That's the easiest way to describe what we do. And we do that through a network of vetted nonprofits. There's 90,000 partners throughout the US and also over 400 donor companies that help us with product and funding. So our goal is to match up donated products with needs. It's a needs-based program. And I focus specifically in disaster recovery. So we'll talk about that in relation to COVID moving forward. But we can't do anything without our partners. That goes with our nonprofits and our donors. We are in the middle. We're a matchmaker. So without product, we don't have anything to match up. And without our vetted nonprofits, we couldn't do the work that we do in their behalf. So that's the Good 360 model. Our collaboration in terms of resilience, we take that very seriously. I think you know, Myra, that we created the Disaster Recovery Council with companies like United and the UPS Foundation, CVS Health. And we are very focused on resilient response. So companies doing the right thing in regards to responding to disasters. And we'll talk about how this was different than any other disaster we've ever responded to and the importance of resilience. But thank you for asking me.
Amazing. Thank you so much, Jim. Christy, let's move over to you, please.
Hi, good morning. My name is Christy Danzy, and I'm the Community Relations Manager for Coca-Cola United. Coca-Cola United is an independent bottler of Coca-Cola products and the Coca-Cola brand. And I work closely with my colleagues at Coca-Cola North America. And I also work closely with colleagues of other bottlers. And during the pandemic, we worked with Coca-Cola North America and other Coca-Cola bottlers that were like right outside of our footprint. We are located in 6 southeastern states. We own territory in Mississippi, the entire state of Louisiana, the panhandle of Florida, the state of Alabama, the entire state of Georgia, and we are in a couple of cities in Tennessee. So we have a pretty broad footprint, and we worked with our local bottlers because we have 54 locations. So we work with our local team, and we work with the local nonprofits in those areas as well to mobilize products and also monetary gifts when the COVID-19 pandemic started back in March. So we collaborated with our internal stakeholders as well as external nonprofits who needed our help as well.
Awesome. And we'll definitely dig into that a little bit more here shortly. Brad, can you tell us about yourself?
Thank you, and good morning, everyone. I'm Brad Keiserman, Vice President of Disaster Operations and Logistics for the American Red Cross. You know, the American Red Cross's mission is to prevent and alleviate human suffering in the face of emergencies, and we do that by mobilizing the power of volunteers and the generosity of donors. When we think about resilience, I always like to begin with what we all think that word means. It's been used throughout the conference. It's used all over the world. And for different people, it means different things depending on the context. I think for many of us, resilience is fundamentally about the capacity to recover quickly from a disaster. And, it's what Jim was saying earlier in his remarks. And so when I think about that, that's really about how we help communities spring back into shape and get back to where they were, or to get to whatever their next normal is going to be. And certainly as we're going through COVID, we're all trying, I think, to sort out what is the next normal. The American Red Cross on a day-to-day basis in the world of disaster, and by the way, we do disaster blood services and biomedical, and then training. I mean, many of you had the babysitter training, and today it's grown to CPR and responder training and a whole range of other community-based training efforts. But in the world that I live in the world of disaster, we respond to home fires every night of the year, 55,000 home fires a year. And then there's COVID. And many people thought, well, I guess the Red Cross won't be doing that anymore because the volunteers can't go out into the community. And we respond to major disasters. The last 6 straight years in the United States, there's been 10 disasters or more each year where the insured loss of those disasters was $1 billion or more per disaster. So $10 billion or more disasters each year for the last 6 years straight. By the way, we're not even all the way through 2020. We haven't hit the peak of hurricane season yet, and we've already crossed the $10 billion disaster line. So as we see more and more disasters occurring, and we do, and now we see those occurring concurrently with COVID, the work we do every day with our partners in communities, whether it's working with Good 360, Coca-Cola, with Southern Baptists, governments at every level, that work that we do with our partner every day, that is the work that lays the foundation that we need together when a community is having its worst day. And right now around the country, many communities are having their worst day. And so it's that partnership of working every day to deal with those garden variety of disasters that's really laying the foundation for community resilience. Back to you, Mary.
Yeah, absolutely incredible. I mean, the diversity with American Red Cross is incredible, and the ability to be as flexible on so many different ranges of disaster is truly inspiring. So thank you so much. And Miss Asha, let's go over to you.
Thank you so much, Myra, and thank you to my fellow panelists and to the Chamber for this opportunity to be here. Truly unprecedented times for where we are today. So to all the audience out there, hope everyone's staying safe, your families, your businesses. And I'm glad we're coming together for this conversation and having this platform. So I'm Asha Verghese, president of the Caterpillar Foundation, which is the nonprofit arm of the Caterpillar Company, otherwise known as the Yellow Iron. And from a foundation standpoint, building resilience has always been part of our core mission and our value. For the last 70 years, Caterpillar Foundation has focused on building resilient communities. That's the mantra with which we move forward in being able to build strong individuals, strong communities. So when the pandemic hit, disasters are absolutely a part of our portfolio, but this was definitely something of a different nature. But there were two essential things, Myra, that really helped us in thinking through what does resiliency really look like, what do we need in order to make progress and positive impact, which were trust and collaboration. And trust in our partners and being able to execute on these programs during unprecedented times, trust in our employees to be able to show up for them, and trust in the communities that we as a corporate partner, as a corporate citizen, is going to continue to support them through these absolutely unexpected times that our communities and our employees are facing. And then collaboration, it's something that the foundation has always strived for, with the ethos that we cannot do it alone. We need partnerships across sectors in order to be able to achieve what we're looking to do in global development. But also for us, even the platform in which we stand, togetherstronger.com is our ethos with which we work, is the platform with which we bring together collaborators. So that held absolutely true, especially in this pandemic, in this particular time of being able to collaborate and execute and build positive impact. And it's still a continuous process. So looking forward to this conversation in how we're navigating it at this point.
Absolutely, yes. And trust and collaboration are two very big keys to making this all work. So thank you everyone for sharing a little bit about yourself. So let's go ahead and get into the reaction process and how new structures have become implemented in all of your organizations, and dig a little bit deeper into that in this pandemic right now. So Jim, with Good 360 serving the nonprofit community through in-kind donations and products like you shared, how does your audience change given the type of response required for COVID-19 and the measures that you need to take right now?
It's a good question because COVID-19 was a disaster unlike anything else anybody's seen. We've talked about that throughout the conference, in that it affected every human being on the planet, as opposed to being in one location during a specified period of time with logical phases of recovery. So it was brand new, and we didn't know it was brand new when it first started. So our first response was to try to work with our partners to stem the spread of the disease where we knew it was internationally. So we worked with UPS Foundation and were able to get some PPE to those initial areas. But it quickly became obvious that it was spreading and it was a pandemic. And our focus changed to be more US based. That's where our network is. We have a fairly robust network here with the 90,000 nonprofits. So we started to focus here on healthcare facilities because PPE was and still is the primary critical need for healthcare facilities. So we do support nonprofit hospitals, but the pandemic required us to look beyond our typical partnerships, looking outside the box. So we spent a fair amount of time identifying new contacts and healthcare workers, networks in major cities, used our contacts, our friends at FEMA and emergency management departments in New York City and other major cities. But even as we established those networks, it became obvious that PPE product was in short supply and high demand. So PPE donations were very few and far between. It wasn't a place that we could play and have an impact. So we turned more of our attention back to basic needs. And this is where Good 360's wheelhouse is. As I said, matching donations of basic goods, personal hygiene, dental products, cleaning products, paper products, shelf-stable foods. That's what we do every day. So as companies were facing furloughs, layoffs, closures, more and more individuals and families were impacted by unemployment and financial hardships. So since March, we've been distributing mass volumes of basic goods to those impacted by COVID. In fact, today, we're actually announcing that we hit a milestone of $125 million worth of donated products distributed since March. That's a lot of product, which tells you two things. One, there's a lot of need. The second thing is that the partnerships and collaborations that we have from donor companies and the nonprofits is working. So this has been the busiest 6 months in Good 360's history. I can't say it any other way. But in terms of new audiences, we've actually worked in different ways with different nonprofits. Toys for Tots, for example, is an organization that we really hadn't worked that much with. But we worked together to get toys to families sheltering in place, over 2 million toys over the last couple of months, games, toys, books. And I think everybody can appreciate the distraction that will help in sheltering in place if you have kids in the house and families. And we're working with Clean the World on a program to allow company employees to assemble hygiene kits at home. So again, we've done that before with kit builds on site, but we had to be creative, and thankfully Clean the World is leading the way on this, and that's an option that we'd love to talk about more with others. Navajo Nation is another nonprofit group that we hadn't worked with before, but we were able to identify needs there and really help an underserved audience. And then nonprofit healthcare organizations, nursing and healthcare associations, 504 Health Net's one in New Orleans, for example, more of that. So our audience is the core audience is still there, what we've been doing all the time. It's in our wheelhouse, and we're very happy we can make an impact. But we have had to find new ways to reach the healthcare facilities. And there's more work to be done there, but we're happy with what we've done.
That is amazing. And congratulations for that success in 6 months.
Thank you.
I mean, and breaking record like that for giving back, and something as simple as basic needs. I mean, people
Right.
forget they're actually very expensive, but these basic, simple needs people cannot afford to get during times like this. So thank you so much. Christy, I want to talk about how Coca-Cola United is addressing its philanthropic contributions, community relations, impact from COVID-19.
Okay. Thanks, Myra. As a local bottler responsible for the production, sales, and distribution of Coca-Cola products in hundreds of towns and cities throughout our 6-state footprint, we needed to mobilize quickly to help where the needs were greatest in our local communities. Immediately, the first thing that we did is we created a 6-figure fund to help with needs for COVID-19. And we distributed those funds throughout our 3 regions. Our 6 states are split up into 3 regions. So we actually created a fund that would help local organizations within those 3 regions. And we also donated 6 figures to our own employee relief fund in case any of our employees were affected negatively by the COVID-19. The thing that we did that I felt like was most valuable to us, we work with our local teams in our 6 states. And again, those are Louisiana, Mississippi, Alabama, Tennessee, Florida, and Georgia. We provided a combination of dollars and products for local nonprofits who were serving the people who were the most vulnerable and the people who were on the front lines, who needed water and who needed other beverages to sustain them. It was also important to remember that Coca-Cola as a bottler, we are an essential business. So we were on the front line. We never got a chance to close, meaning we need to continue to serve our customers like local grocery stores, local convenience stores. Those stores are serving the general public for their basic needs. So therefore, we were wearing 2 hats during this pandemic. We were serving our customers as they served our consumers and making sure that everyone had what they needed during those first critical weeks of the COVID-19 crisis, and throughout what's happening right now. We are still doing the same thing, and we are still channeling our funds toward any types of initiatives that are COVID-19 relief.
Awesome. Thank you so much, Christy. Brad, can you go into the American Red Cross and what it provides? Obviously, you shared a little bit. It provides a number of services to the community. Very diverse range. So during this time, I've even witnessed here in Atlanta, you've shifted your blood drives, how you deliver supplies, and much, much more. So how are you also taking steps to prepare for hurricane season, as you briefly mentioned a little bit earlier, with the limitations and the parameters that this global pandemic requires us to follow?
You know, we were in January, talk about partnerships and resilience. In January, we were receiving data from Johns Hopkins University about what was then believed to be a flu outbreak or a novel disease outbreak in China. And we began to see through that data that it was very likely that that disease could go pandemic. And so we began preparing in early January for a pandemic, but I don't want to make that seem like there was some visionary preparation going on. If you had asked me in the middle of January, is this where I thought we would be where we are today? I wouldn't have seen around the corner that far. But we did see down the road a piece, even if it wasn't around the corner. So we began preparing immediately. And I think we rapidly identified 4 very specific risks across the enterprise, whether it was our biomedical business or whether it was the disaster services and humanitarian services we provide, or the training that we provide. And the 4 risks that we really felt we needed to focus our mitigation on were, first of all, the risk of our workforce, which is 95% volunteer, but the risk that our workforce becomes sick, the risk that our clients, the people we serve, become sick, or the risk that our blood donors become sick. So how do we mitigate the risk of infection for the people who we serve and the people who serve those people? That's number 1. Number 2, and I guess I should address these as we go. So how do we mitigate that risk? And as Jim said, that really does begin with, first of all, identifying a single source of truth. So we turn to the Centers for Disease Control, CDC, and we react to CDC guidance. So as CDC describes what they feel is safe mitigation with respect to masks, gloves, gowns, other PPE, other physical interventions like barriers, then we were adjusting our operating standards. And we worked closely with our partners at FEMA and CDC throughout this to make sure that we understood what the standards were, why those were the standards, and how we could help drive those in our work. So that included changing the way that we did blood drives, making sure we were screening blood donors, setting appointments, making sure that all of our folks had PPE and the right kind of PPE for those kind of encounters. Disaster is a little bit different. Imagine you have a large apartment fire, in which we've had a number of these in the last 6 months in the middle of the night, and hundreds of people are streaming out of that building. Well, when we send volunteers to those apartment fires, they can't control social distance. It's not like when you're just one-on-one with a family where you can maintain 6 feet and everybody wears a mask and we can bring masks to the scene and give them a mask. This is a nearly uncontrolled encounter. And so we found that when we were sending responders to those kind of events, a surgical mask isn't the answer. You really do need the protection of an N95 and possibly a face shield, because you're dealing with people who may be asymptomatic or may be symptomatic and were in their homes before a fire struck. And then there's the sort of larger piece of what we do day in and day out, which is we provide mass care and shelter services. So when people evacuate from their homes, whether it's an apartment fire or a wildfire, a dam break, a flood, we'll talk about a few of those in just a second here, that some people have nowhere else to go. And so they go to a Red Cross shelter, which is normally, the gymnasium of a school or the central room in a community center or a church basement. And the Red Cross provides cots and blankets, hygiene products, food, financial assistance, case management and case work, health services, mental health services. So everything I've just described to you is fundamentally about people getting close to one another. It's me sitting on the cot next to you. So the very thing that we do that helps people in the past, well, this year, that's the very thing that puts them at risk. So this was fundamentally about how do you continue to deliver services while mitigating risk? Because I can tell you this, our philosophy from the beginning has been COVID-19 is not going to change the mission that we do. That mission I started with earlier about alleviating human suffering. COVID-19 does not change the mission. It just changes the way we do the mission. And so we had to quickly adapt tactics. We had to talk to our volunteers and say, hey, what's working in these encounters? What's not working? It's great to tell everybody that they're going to wear a mask and do these things. But there's a great saying by a Prussian general, von Moltke, who basically said, no plan survives first contact with the enemy. And so all the planning and all the tactics and all the doctrine, in the end, it's about human beings who are encountering each other in a chaotic environment. So how do you train people? And we've been focused on this. They're not going to read a lot of documents. They're going to listen to training, learn to training. So that meant webinars and reaching out to all of our volunteers and helping them understand the changing landscape of mitigating those risks. And then I'll just talk quickly about one of the other risks we really felt we had to mitigate. And that was, we don't want Red Cross blood donation centers or Red Cross shelters to be perceived as a source of infection, because people have to trust those locations as being safe. If they don't, they won't go there. And if people don't go donate blood, many other people die. If people won't go to shelter or refuse to evacuate, that can mean people staying in the path of a wildfire or staying in the path of a hurricane or choosing to stay in their home during a dam break rather than evacuating and going to a shelter. And so it's being able to create that confidence. The last thing I'll share is we tried to avoid opening congregate settings wherever possible, because it's not going to be avoidable in hurricane and wildfire season. Evacuations are simply too large. But for some of the disasters that we encountered this year, like tornadoes in the Midwest and tornadoes in the South, the dam break up in Michigan and Midland, Michigan, just what's about 60 days ago now, we were able to secure hotel rooms for people who would have otherwise had to been in congregate sheltering. And so we've provided now over 40,000 hotel overnight stays in the last 5 months for people who would have otherwise had to be in congregate and at greater risk. And so it's just those kind of adaptations that have really driven us and that we've been trying to drive through COVID.
And even as you mentioned, with the Red Cross and everyone being so different in this group and everything we do, and Red Cross being 95% volunteer driven, as you said, and being such on the front line, as you're mentioning, and it doesn't change. You still have to serve the purpose that you're doing on a daily basis, pandemic or no pandemic. So a question that came from someone real quick, I just want to go ahead and address while we're on this, is with regard to mental stress and fatigue, any thoughts on best practices in addressing such actions that you are having to take and you're on a daily basis with it being so driven by, first responders and volunteers?
And I missed the first part with regard to, did you say medical stresses?
Yeah, with regard to mental stress.
Oh, mental stress. Okay.
Yeah, like any thoughts
great.
on best practices? Yes.
Within the first week or two of COVID, we immediately opened up a mental health hotline for our disaster volunteers and for some of our blood donation volunteers and employees, and said, if you're uncomfortable with any of this, if you have questions, if you just need to talk to somebody, call. And so we began to get a lot of calls from folks who had questions and just wanted to talk through. And for an organization like the Red Cross, we have some great partners who are in the mental health space. So we were able to work with those partners to create some capacity there. And then in April, we opened a call center for those who have suffered fatalities due to COVID to provide that community, especially vulnerable populations, as a sub-community of those who've experienced direct losses due to COVID, to help those folks with mental health services and health services as well. The one personal anecdote I'll share is this. Separate and apart from what our workforce sees every day in terms of actual human suffering, there's what we're all doing right now. And while I don't think it necessarily constitutes human suffering, we've all fundamentally had to change the way we work and the way we live, and we're not really tethered to the same foundations we were in January. And that untethering, if you will, is stressful. It creates stress in every relationship in your life. And we've really been working with our workforce, both paid and volunteer, to make sure that people don't sit in front of this device all day and all night long, because it's easy to sit in your spare bedroom and just work forever. But you've got to create boundaries, because in this particular world, in this virtual world in which we now operate, there are none. And that can be a benefit when you're coordinating and collaborating in operations, but it can create significant mental stress for all of the folks who are doing this work.
Absolutely. And that's a really good point. So thank you for sharing that. And even Christy mentioned earlier that they took care of employees, quickly, that were having to move quickly and respond quickly. It wasn't a break time for them. So you're seeing this with Coca-Cola, you're seeing this with Red Cross. It's there. So Asha, as we're hearing and as we know, the COVID-19 pandemic has a tremendous impact on communities all over the world, and you being on a global level. And also the way corporations and NGOs, non-governmental organizations, approach disaster response. How has Caterpillar Foundation managed all of this in this unprecedented time?
Right. Yeah. No, I couldn't agree with you more, Brad, on the mental stress. And as a global company, Caterpillar, with 100,000 plus folks, and our dealers, definitely creating boundaries, and was definitely one of the big messages that we took out as employees and as essential workers in the manufacturing space. But to answer your question, Mara, thank you for that. Disasters is not something that is new to our portfolio. Our focus being resilient communities, our partnership with the American Red Cross has been a long-standing one for us. But as the fellow panelists said, this is a pandemic of different nature. It's what we're calling a borderless pandemic. And the impact of this is not just contained to one space. It's not just healthcare. It's the economic impact. It's the community impact. It's just, we're in it. I mean, a lot of times you look at disasters and you respond to disasters. It's happening somewhere else. It's natural in its course, but this is where we're actually living and breathing the disaster as we go. So as a company and as a foundation, we had to truly pivot in the way we were thinking about engagement. And someone previously talked about, early engagement in China. So we have a significant presence in China with our employees, and that allowed us to engage early on in January, but not giving us a roadmap by any means, but at least looking at it to say, what is it that we need to do differently if this truly becomes a pandemic? And I think one of the big lessons learned for us in there is how do we be more nimble? How do we react quickly to at that point, not a pandemic per se, but where there is a sense of urgency, and how do you respond to that quickly, where it's not just about healthcare PPEs, it is about protecting your community from providing them with food or education, all of the different pieces that need to go into that. So I think being nimble was sort of the first lessons learned from China, that now in March, when we were reacting to it at a more global scale, we had to truly pivot a lot of our internal processes to be able to engage with our partners, both old and new partnerships. So interestingly enough, Caterpillar went through a strategic shift, but at the same time, we were able to engage with some of our old partners in providing that direct support, whether that's engaging with the food banks to be able to react quickly. One of the other things I would say for us looking, this is an ongoing marathon, as the title goes. So there's a component of immediate response, but also not losing sight of what that long-term response should look like. How do we pivot ourselves to be able to take the lessons learned from what's happening right now and really strategically shift in how we're going to be giving in the future? Our NGO partners are going through this shift with us. So how do we co-design along with them and co-create some of these solutions for what we're going to possibly be calling a post-COVID era in social development? So that was a huge shift for us, looking at our giving moving forward. The other big piece that I want to highlight, and I'm sure other corporations can relate to this, is the employee base that we have, and their want to be able to react to activities in their communities. So our Matching Gifts program was a great avenue through which we could engage our employees fairly quickly in providing them with a 2-to-1 match, and we were completely blown away by the reaction. In a matter of a few days, we had to increase the cap that we had on our matching gifts because employees had just blown that out of the park. And almost close to 600 nonprofits were supported as a result of that engagement. And it just goes to show that our employees are going through this crisis along with us, but it's the ethos with which they work and wanting to give back to communities. So that to us is another avenue and a vehicle. And then our focus on basic shelter, basic human needs. I think for us, having focused so much on the value of water and how much that has played a role today, especially in developing countries where hand washing has become such a critical part of this particular pandemic and its prevention, in being able to provide that type of basic human services, whether that's water or energy, in being able to support places, outside of where we are and where water is such a critical part of it. So a lot of different components that went into thinking, how do we pivot? But more importantly, it's making sure that we stay nimble in being able to react, not just short and long term, but also being able to pull on some of these partnerships, both old and new partnerships, as we go through this journey.
Absolutely, yes. And here we move forward with the power of partnership and all these real life examples on how it's helping all of us function. And I think it's a great point asking the question early when the pandemic was approaching, and then continuing not to forget to still ask it now, like you mentioned, we still do not know when this will end. Right. Do we ask, is this going to be another year? And how do we continue to prepare? I've definitely seen success in these matching programs as at Tegna with our company. It has been truly inspirational to see people come together. And I've made sure to point to our team as well. Like, people are still wanting to give, people are still going to join hands, even those that have suffered, but maybe know that they're not suffering as bad as other people. So thank you for mentioning that. And so you talked about PPE a little bit, and Jim, you mentioned it as well. So just to kind of go into that a little bit more, and the essential items that are so simple, can you give or share an example of how you've been able to work through the enormous demand at Good 360 and work with the suppliers to get the goods out specifically?
Sure. I want to first ask if we can get additional time, because what Brad talked about and what Ashley talked about, we could talk about for hours. It's just an amazing time for us all to kind of evolve. And Brad, I will tell you that the American Red Cross locally was very safe, very welcoming, and very tenacious about getting me to come in. So kudos to them. So for PPE, early on, as I mentioned, the UPS Foundation was involved with us. They're a great partner, very creative. They were working with Kaiser and some others to develop a network where companies could donate excess PPE, even non-medical, and get that to hospitals that needed it. We worked on that. We had some success with it. And then I realized that that was happening all over the country. Networks were being created by cities, by regions, by states, national. The creativity was just amazing. And that's all very fortunate. Companies like CarMax and Gap for us donated masks that they found in their facilities. All of that, though, as we know, did not reach the critical level of demand that was out there. Again, we were facing high demand and short supply until fairly recently. So during that time, that's when some unusual networks started for us and some collaborations. One for us that I think is interesting, kind of shows what I'm talking about, is the Ironman Foundation. They had already partnered with a company called FrameBridge that manufactures frames. That's what they do for their business. They wanted to pivot. Their owner runs marathons, so he reached out to Ironman Foundation and asked what they could do. So that turned into 50,000 unused Ironman event t-shirts, since the events weren't going on, being sent to FrameBridge to be processed into masks. And then again, with the help of the UPS Foundation, Good 360 is getting them where they need to go. So just one example of many. Reverie is a bedding manufacturer who also pivoted to manufacture masks, and we got those masks to Tufts Medical Center in Boston. There's just dozens and dozens of those kinds of stories, creativity and passion. Several people have mentioned their employees. For Good 360, we're often dealing with donations, inquiries and requests from people who want to donate their products. We work only with companies, but the passion's there. And in this pandemic, no individuals could donate any product to help. They didn't have PPE in their closets. Companies had some PPE in their warehouses, but the level of individual support that we've seen for this pandemic is unparalleled. Through employee donation programs and through donor advised funds and all along those levels. The passion, again, from individuals wanting to do something, anything, has been extremely inspiring. So PPE, as Asha mentioned, is one of those things that we gotta keep going. We're not done yet. It's still a need. We are getting higher volumes. We are getting higher volumes of donations, thankfully, and we're able to get more of the donated PPE out. And new groups are still emerging. There's one Jersey City Rapid Maker Response Group, if I got that right. They just came up. It's a pop-up nonprofit, and they're creating masks and face shields in high volume. It's not their full-time jobs, any of these people, but they're doing it, and we're helping them get those placed. So again, just the need is going to be there for a while. We can't let down our guard regarding PPE or the basic goods that we're already working on. But if we all work together and continue to be creative, I think we can solve these issues.
Absolutely. Yep. Thank you so much. Christy, let's talk a little bit about timelines and deadlines for people. So given the unavoidable inability of many organizations to achieve their goals and timelines right now for their work still to be done and their programs still to be done, how did Coke United and how is Coke United working with those organizations to honor commitments in place for 2020?
Okay. Thanks for that question, Myra. We are a very philanthropic company. And first and foremost, Coke United is about serving our communities as we do by building and maintaining strong relationships with our customers and our local nonprofits. We had several nonprofits who have events that were in the pipeline for 2020. And we support those events, we support those nonprofits, and we wanted to continue to support those nonprofits, but not knowing exactly how the rest of the year was going to go. We had to, the resounding theme here is to pivot our funds in different areas. So the need of some of our nonprofits was amplified because of COVID-19, such as the United Way and other community organizations. They went straight into helping immediately for families who were not working anymore, for children who were not in school anymore, for lunches and things of that nature, because it happens so fast. So what we had to do was we had to look at our list of organizations that we support on an annual basis. And we wanted to look at the organizations, first of all, who were serving the ones who were most vulnerable. So what we did with those organizations, we increased the amount of money that we were already giving them and pulled some of those contributions forward, because some of them we may have contributed to them later on in the year. So what we did is in March and April, we pulled their maybe November or December contributions forward to give them a leg up to be able to help those families who were most vulnerable. Other organizations that we support on a yearly basis that would have events and everything, we put those things on hold and we communicated to them that we still wanted to support them. But at the present time, we wanted to turn all of our attention towards any organizations in our 6-state footprint who were on the front lines for helping with COVID-19 support relief initiatives for elderly, for children, for law enforcement, for nurses and doctors. That's where, we still wanted to honor our commitments, but we communicated to them, this is where our money and our focus needs to be right now.
Awesome. And I'm sure that everyone was understanding during those times, because it's already hard enough for your fundraising events, which are a very vital part of your year, to raise for these nonprofits to raise funding, to be taken away overnight. So thank you for all you're doing at Coca-Cola United to make them still thrive and give them the opportunity to keep going.
Thank you.
Absolutely. Brad, I'm going to go over to you, and I have one more round of questions. We have about 15 minutes left, so we're going to continue to go through these briefly and try to get to a couple extra questions we got in our chat group. So Brad, I just want to go into a little bit about what the biggest strain has been on the American Red Cross. Where have you seen the greatest needs? Which I do have to give kudos as well. We, at the 11/11 Atlanta, we had a great, in my recent project with you all last week, blood drive that was very seamless, very successful, and very good spirits there. So, good energy, good congrats for that. But what have your biggest strains been? Where have you seen the greatest need?
Yeah, and absolutely. We were very concerned at the outset of COVID that folks would back away from giving blood due to perceptions about safety, and to Jim's point about being very safe and very tenacious, both in trying to continue with blood drive activity and also to let people know that it was safe. The Surgeon General of the United States tweeted out and did some press and really emphasized that the blood was critical and it was safe to give blood, and that helped tremendously. And so we've seen a very regular maintenance of the blood supply, which again, given some of the impacts of COVID, and it's not just COVID, right? We're still seeing all of the other illness and disease. And even though elective surgery has been reduced considerably, there's continues to be significant hospitalization in emergency medicine and a need for blood. So we're pleased that we've been able to work with our partners and with the public to continuously meet that need. With respect to disaster, I think the biggest challenge that we have lies ahead, and that is with what is now forecast to be a very bad hurricane season, well above normal, and what is forecast to be a well above normal wildfire season, particularly in Northern California, Washington State, and Oregon. And so going into the next 90 days where all of that disaster activity is forecast, and by the way, it's forecast by some very reliable forecasting organizations who are very aligned in what they're seeing. But to do all of that in the face of states erecting travel restrictions in order to try to protect their populations, well, that means I can't bring volunteers in from out of state, or if I do bring volunteers in from out of state, we've got to make sure they're complying with state law about coming in. It also means that people who are volunteering and perhaps deploying to disasters may have to quarantine when they get home. So it's the complexity, the complications involved in just basic logistics movement, the movement of human and material resources to help others. We've been able to meet those challenges. I have no doubt we'll be able to continue to meet those challenges. But it's just not a normal, it's not a normal year in any way. It is that, as Asha said, it is a pandemic without borders, and that includes state borders. And so just trying to make sure that we can keep all of the resources moving. And then we've got a very large virtual component of our operations. We've taken everything we can that can be made virtual, and we've made it virtual so that we'll have a smaller footprint, but not a smaller footprint in our client-facing service delivery.
Awesome. And there's still success in virtual, as we see here now. So thank you. Asha, Caterpillar is a global brand, as you've mentioned, with employees all over the world. So what are some interesting points that you've seen in terms of response on a global level? And or are there any lessons that you can share?
Sure. As I'm listening to my fellow panelists, what I found very interesting and probably transferable across all of our organizations, although very different in nature, is that we all chose to look internally for innovations and technology to determine how we or our partners or customers can, how can we respond effectively to this pandemic. And I think, Jim, you gave some great examples of how innovative your partners were, and very similarly at Caterpillar, I would say, you know, when you think of the construction industry and the using of N95 masks, and where our dealers came together to make depots where people can come collect PPEs, whatever they could provide as part of the initial crisis that we saw in the lack of PPEs. But all that to say is it's truly pivoting in that engagement and the partnership what really got us to where we are today. But a couple of lessons learned, I think, as you think about companies like CAT, where it's such a global footprint, but at the same time, this is affecting communities after communities where we live, work, and play. So although global in nature, it was very important to have hyper localized solutions, because every community was different in how they were reacting and how they were being impacted by the pandemic. So what we looked internally and leveraged is the scale that we have as a company. We have employees across the globe, we have facilities across the globe. So how do you leverage that on the ground access to what's happening in their communities and engaging those facility partners of ours internally, plus our dealer network, to be able to mobilize funds. So we know that we're responding to issues that are very much focused in their communities. And what's interesting in this disaster, as I'm sure my panelists in the audience are going through, is that it could be PPE in one, it's probably the food bank in the other, or it could be you know, looking at the Boys and Girls Club, where students are, you know, not in schools and they're in underserved communities, but we need to have a way to be able to engage with them. So, and then interestingly enough, a lot of hyper localized solutions, but at the same time, how do you leverage some of our global partners like the Boys and Girls Club or the food bank to be able to leverage their scale to react as quickly as we needed to. So I think those are all great lessons learned for us to be able to take a global pandemic of this sort and be able to then localize it fairly quickly. And it was very important for us to look at some of the targeted locations too, whether that was Italy, Brazil, And I think Jim had mentioned the utilizing DAFs, the donor advised funds, but we utilize them very differently in this space, where they went in and looked at which are the hospitals that needed support and how could we provide it to those hospitals in all of these different countries. I mean, you're talking about what's happening in Italy was very different from Brazil, India, and Indonesia. So I think being able to mobilize that from a very business perspective and looking at supply chain processes is probably what we've been able to leverage internally, but being able to execute on that externally. So I would say those are some of the big lessons learned for us in being able to mobilize our response as quickly as we could.
Awesome. And great, time passes fast. We have about 7 minutes left. So I'm going to try to get through one more question each person, and throw the questions from our audience in with it, so you can try to knock this out together. So Jim, what have you learned through this pandemic response? Are you continuing to evolve your operations? And would you provide any insight on innovative ways that technology has been used to help, even maybe including social media? Those two. And that's going to...
Yeah, I'll take the last part first, and just a quick answer, and then I'll start talking really fast. We're working with IBM, and they have what's called IBM Business Risk Insights, and that's an IT program, a platform they're developing that we're helping test that really did help us, just like the Johns Hopkins dashboard, to identify where the hotspots were across the world, and specifically in the US by city. Because what we wanted to do is identify who needed what most where. So technology like that was really rapidly increased in terms of development. So I'll mention that one. Two big learnings. Don't let me forget the second one. So the first one is a pandemic is not the right time to exchange business cards. So we have to revise what we've been saying forever. But what's important is to establish partnerships and relationships ahead of disaster. That's more important than ever. And I think we've all relearned that. Having the UPS Foundation, Covery's Community Healthcare, Center for Disaster Philanthropy, all on our side before this hit really helped us, because we were able to get support from them immediately at the start of this. Also, companies, American Eagle Outfitters, CarMax, JF, Ecolab, CVS Health, United, Verisk, Booz Allen, all of those are companies that fund us with discretionary funding. And what's important about that is it's not for something specific, one thing that we have to do on their behalf. It allows us to be flexible. And without that discretionary funding, we wouldn't have been able to jump in early like we were able to do. So that's something for everybody to learn from. And the second thing was that we need to listen harder to our partners and think outside of the lines. So instead of just being transactional, being transformational. I'll just give us some quick examples. Coca-Cola, right out of the gates, wanted to help. So what did they want to help with? Is not just beverages, but nutritional beverages for those in need who actually needed something beyond just water or a beverage. So we were able to help place some of those in California and some other hotspots. Hasbro provides board games, but those board games were suddenly essential for quarantine families. So we put together play relief kits and got those to quarantine families that probably, again, saved their sanity. Bed Bath & Beyond wanted to get large donations to Javits Center. That's not a nonprofit. So we had to help them find contacts and network and get towels and pillows to Javits Center and other expanding hospitals. They actually committed over $10 million to bringing Home Everywhere. Nike wanted to donate shoes. So they created a pair of shoes that's developed for healthcare workers. So we helped them place 30,000 pairs of shoes. And obviously the list goes on, but I guess what I'm trying to say is companies, use your assets, use what you bring to the table. If you're Tempur Sealy and you have beds, get those beds to emergency operations centers that are sleeping on cots. That's another example. So I'll stop there and give everybody else a little bit of time, but the examples that we have from our company and partners is amazing.
Thank you, Jim. That's incredible. Establishing partnerships ahead of disaster, super important. Christy, since Coca-Cola United provide beverages, how did you manage the overwhelming request for overall product donations during the pandemic? And if you can tap in as well with Jim into this social and technology side of any inspirations that have came about during this as well.
Okay. Thanks, Myra. And as you can imagine, the need was extraordinary for product donations when COVID-19 first kicked off in mid-March for us. We gave donations to health workers, first responders, childcare services, and nutrition-based services for youth and elderly. So those types of organizations became our priority at the very beginning of the COVID-19 pandemic. People don't always realize that a Coca-Cola bottler, we are a first responder. And anytime there's a crisis, we know that we have hurricanes and floods and tornadoes, and we always donate water, but people forget about the other products that are in our portfolio, like he said, for nutrition-based needs. And we donated all those types of things, Monster Energy, body armor. We donated different things that were geared towards children, like our Tummy Yummies. So we had a variety of products that we could donate to these organizations. And those organizations, like I said, became our priority during the first part of the pandemic. And we are still supporting many of those organizations today. And we are probably looking forward to a continuation of support in that we are in the second round of what's going on with this pandemic. Tell me your second part of your question again, as far as technology.
Yes, the second part of the question from an audience viewer is, would you provide any insight on innovative ways technology has been used to include even the usage of social media?
Well, actually, our company went silent on social media as far as the pandemic was concerned. We didn't do a whole lot. We did a lot of posting about the good that we were doing in our footprint. We didn't want to have a lot of lights and whistles around what we were doing as far as, kind of tooting our own horn as far as giving out money and products. So we didn't do a whole lot in the social media arena, just around our donations, just because this was nothing that we wanted to pat ourselves on the back for, or, anything for us to be happy or elated about. We just kind of did it under the radar.
That's very enlightening to share. Thank you. All right. Thank you so much, Christy. Brad, is the American Cross looking at trends? You've shared a little bit about how you have or how you did, but are you continuing to forecast on what type of demand the nonprofits and other social services are going to require in the coming months?
Yes, I think one, as I said earlier, we are expecting, based on the forecasts, a very, very challenging hurricane and wildfire seasons. Separate and apart from COVID, those would be challenging seasons. To see the convergence of wildfires and hurricanes expected at above average level, and so that looks to me, without COVID, like 2017, Harvey, Irma, Maria, Tubbs fire out in California, just had back-to-back disasters. 2018, very similar. 2019, not quite as apparent to, I think, the American people, but there were many smaller, medium-sized disasters. It was just an unending rhythm. And of course, people tend to it takes longer now for people to recover. And I think that's what the biggest trend that we're going to see going into this fall is that the convergence of wildfire season and hurricane season, both forecast to be particularly bad, with COVID. And it's not just COVID, but it's the compounding effects that COVID has had now over time. People are beginning to feel the economic impact of COVID. They'll likely begin to feel it some more. I realize the job numbers looked a little bit better when the numbers came out this morning. But again, if you look at the trends, we're coming up to yet another peak in COVID infections and fatalities. And so I think as we step back and we look at the epidemiological curve that's emerging, we may not even be out of the first wave, right? We may still very well be in the first wave and coming to the true peak of the first wave, which I think is where we're at. And so as those compounding effects of economic impact, physical impact, grief over the loss of loved ones and impact of people's health happen, I think we're going to see resilience challenged more and more. And that's where the benefit, I think, of this particular conference comes together, is the partnerships that it's going to take between the private sector, the nonprofit organizations, and government with communities is going to be very intense, because there's no sector that can solve all of this on their own. It's only going to be through a collaborative effort that we can deal with these compounding issues. And my message for everybody is, and I hate to sound like the doomsday sayer, but I think it would be unrealistic to say otherwise. The worst is yet to come. We're going to see a category 3 or 4 hurricane make landfall somewhere in the continental United States. And that's going to happen in a state or multiple states where COVID infections are at critical level. ICUs are already full. There'll be movement restrictions, and suddenly you'll have tens of thousands of people in congregate settings whose homes have been destroyed. And then at the same time that happens, don't be surprised to have a wildfire in Northern California with similar impacts. So I think we have to be prepared as an emergency management community and as a responsible corporate and business community. We have to be prepared to face that reality here, frankly, anytime over the next 90 days. And I agree with the point that you were making earlier about the time to exchange business cards is not in the middle of a disaster. We have a few weeks left, likely, before we get that first major hurricane making landfall. So it's time to make final preparations and get ready. That's where I see us going.
Thank you, Brad. And can you share anything on the technology or side that you have maybe changed, or anything innovative you've done differently?
We've been in the Red Cross using a system called RC View, which is an ESRI product that we have due to very, very generous funding from multiple donors, especially Walmart, who've been a great partner in this. The American Red Cross is at the cutting edge of the use of geospatial information and data analytics in disaster and emergency management. I mean, I've been doing some form of crisis leadership for 30 years. This tool is incredible. It really helps us to see what people need, when they need it, where they need it, by using geospatial data and data analytics, and being able to see that visually in a data visualization with hard data fundamentally changes the way that we can help alleviate human suffering. And you asked earlier about social media. You know what? People will tell you what they need, when they need it, where they need it. They will tell you on Twitter. They will tell you on Facebook. They will tell you on TikTok. You just have to pay attention. And that is, I've really seen the Red Cross over the last several years working with government partners and corporate partners. Listen on social media, and then be able to take that and turn that into actionable service delivery. And to be able to share that information with our partners in a partner hub so that we can each see what we're doing, and then we can see where the holes are and fill those holes together. I think the potential for technology to improve collaboration and coordination in this community is just beginning to open up, and we're just starting to see the benefits of that. And that's a silver lining in all of this. COVID has forced us all to embrace this a little more quickly. And I think, since looking for a silver lining, and to me, that silver lining is the use of technology in this response.
Thank you so much, Brad. Absolutely. And Asha, we are ending with you. I had one question left on how you can tell us the Caterpillar Foundation, how they've engaged in your partnership a little bit more and channel your response. And if you'd like to tap into the technology and social media a little bit too, that would be great.
I'll just close this out for you, Myra. Thanks for that question. I think the reality of this particular pandemic is that, we're finding ourselves to be in the middle of this problem, right? So it's affecting all of us in some way, shape, or form, whether that's the pandemic combined with social injustice. So I think as much as we're all responding at a rapid pace, this is also a moment for us to pause. And as Brad and Jim and Christy said, really listening to what is happening around us and then reacting to it in the most efficient, effective way. So I think what this pandemic has really taught us, and where we are currently in our environment, is really to be able to take that pause and be able to listen in order to respond to the issues that we're facing. As for technology, we have a significant focus on workforce development, but I think the way we're going to be executing on our solutions is going to look very differently post-COVID. And that to me is really leveraging technology. I mean, the fact that we're all on the Zoom call and talking to thousands of people is a testament to how technology is being leveraged. But I think in the delivery of education, we're going to be looking at it very differently to understand how technology plays a role in it, in being able to deliver goods, whether it's leveraging advanced manufacturing, 3D printing. I think all of that, the private sector and corporations have a role to play to be able to leverage our own internal assets as far as technology and innovation goes, in order to be able to make communities more resilient. I think at the end of the day, I think that's what we're all striving towards, is that systemic change. And where does technology innovation play a role in it? But all of that, I just want to kind of sum it up to say, the things we learned out of this is, how do we stay nimble? In order to be able to react very quickly, how do we collaborate? I think we've all been on panels to talk about collaboration, but I think this is one of those instances where we've truly kind of put where our money is, to say, we have to collaborate. There's no other way out of this pandemic and post-pandemic. So I think this has really brought those partnerships together and helped build that trust across sectors, public, private, social, all of those sectors, to be able to really come together and build those partnerships on the basis of trust, on the basis of collaboration, and on the basis of leveraging our technology and innovation.
Can I add one thing to that? Asha, you made a point earlier that I think ties into everything everybody said, which is everything we've talked about here is building resilient communities. I know that's a phrase that you use. We use that actually internally as well. But everything that we've talked about, Brad, Christy, all of our approaches, if we can just stick to that, we'll be a lot better off. So I'm really glad to hear from everybody that we've got that going.
Absolutely.
Absolutely. Thank you to each of you for sharing your wisdom, your passion, your drive, your resilience with everyone. I mean, this is super powerful and extremely inspiring what you're doing for the world, for the community. It would not, the help would not be there without people like you and without organizations and companies like you. So thank you for all you're doing. Thank you for joining us today. And we hope everyone that was with us enjoyed this and took some wisdom out of it for everything that you continue to do. And may we continue to be a domino effect to the world during this time and forever. And, stay bright and safe during these times. Thank you so much, everyone. Have a great day and continue to stay safe and joyful as much as you can.